My name is Rojas-Rozo. I work with the ROSA team in Quebec. This is Team 19 from CCNA. And today we're going to talk about the experience of persons living with dementia and care partners with the use of health and social care services in Quebec. We're going to focus on preliminary results. We know that persons living with dementia in Canada have been severely affected by the COVID-19 pandemic due to a high risk of severe COVID or due to public health measures in place. This is a qualitative descriptive study in which we aim to have 20 interviews with persons with dementia and care partners, 10 each, and we plan to understand what are the experiences and expectations with health and social care service use during the pandemic, specifically in terms of human rights. To be able to do so, we are going to analyze the data using a hybrid thematic analysis guided by the World Health Organization framework, ensuring the human rights-based approach to persons living with dementia. In terms of participation, care partners shared that the health services and social services that they received before the pandemic stopped, such as day centers for persons living with dementia or help received at home, which limited the possibility of having any kind of social participation or stimulation. Services offered were not adequate for their characteristics. For instance, the mandatory use of an email address to access a vaccination passport or the use of technology for telemedicine. Similarly, various care partners shared that it was very difficult for persons living with dementia to follow public health policies, such as the use of a face mask. When decisions were taken, they felt that their preferences and the needs were not taken into account and felt that these decisions were imposed. In terms of accountability, care partners felt that they lacked the knowledge on how to claim their rights and those of the persons they care for. And for instance, having the possibility to refuse a treatment. And they say that even when they knew how to claim these rights, it was very difficult to do so, as one of the participants voiced. You cannot get too angry because you don't want the organization staff to mistreat them because they have no defense. Care partners were also not allowed to visit. Some went even more than 2 months without seeing the person they care for. And they also felt that private residences had stricter rules compared to public institutions, and there was no transparency on why or how these decisions were taken. In terms of non-discrimination, they felt that because of the diagnosis of dementia, some of the services were denied, as, for instance, power of attorney was not respected to access financial services. This led to longer waiting time and processes needed to be able to finalize a simple transaction. This also was perceived of a lack of awareness by the general public on dementia diagnosis, and also led to discrimination in the administration of treatment because they didn't explain what they were going to do. The person didn't have the possibility or the knowledge to say, I don't want this treatment. In terms of empowerment, care partners said that even if they had the rights, the knowledge on the rights, they were not fully respected, as in the case of the power of attorney not taking into account for accessing some services. And care partners also had the impression that the persons taking care of their loved ones in institutions did not have the qualification nor the knowledge needed to treat someone with dementia. As a conclusion, we have identified areas in which human rights for persons living with dementia and care partners were not fully respected during the COVID-19 pandemic in the province of Quebec. These results can help us identify these potential barriers and facilitators they may have faced during the COVID-19 pandemic, specifically in terms of human rights, and will potentially help us develop recommendations for better care for persons living with dementia that supports their rights. Thank you.